Think about yesterday. You were busy, right? Calls, meetings, messages, work. But at the end of the day, did you feel satisfied or just tired? Most people confuse movement with progress. And that's where life quietly slips away. If you work in pharma plants, laboratories, hospitals, or healthcare operations, this feeling is even stronger. Long shifts, documentation pressure, audits, and patient responsibilities often make days feel full, but not meaningful. Time doesn't disappear suddenly. It leaks, silently, daily, through habits we never question, through thoughts we think are normal. Today, let's expose 12 silent time wasters that steal years, not minutes, from your life. And once you see them, you'll never unsee them. In regulated industries like pharma and healthcare, time wastage is not just personal. It directly affects compliance, decision quality, and ultimately patient safety. This is not a motivational video. This is a mirror. If even one point hits you, this video will change how you see your time forever. Making mistakes is human. Repeating them is costly. Same workplace issues, same personal conflicts, same excuses. History shows us, empire fell not due to lack of strength, but due to refusal to learn. Ask yourself honestly, what mistake am I repeating again and again? Silence here is the answer. In pharma, this is visible when the same audit observations, deviations, or compliance gaps repeat year after year. Each repeat is not just lost time, it is a warning sign of weak systems. Perfection feels safe, but it delays action, and delayed action delays life. Many people wait for the perfect moment. That moment never comes. Progress comes from done, not perfect. Start imperfectly, refine later, live now. In quality and regulatory work, perfection often delays implementation. A controlled, approved SOP used on the shop floor is safer than a perfect draft stuck in review cycles. Without priorities, your day controls you. Everything demands attention. Emails, calls, messages. Everything feels important. But energy is limited. Time is limited. Life is limited. One clear priority can save hours of confusion. Ask every morning, what truly deserves my time today? In pharma operations, everything feels urgent: deviations, mails, reviews, and inspections. Without clear prioritization, truly critical quality risks get delayed. Motivation is misunderstood. You don't act because you feel inspired. You feel inspired because you act. Waiting for inspiration is like waiting for fuel before starting a fire. Move first. Feeling follows. GMP systems were not built on inspiration, they were built on discipline and action. Improvement in healthcare starts when someone acts, not when they feel motivated. Doing everything yourself feels responsible. But it slowly burns you out. Even the strongest leaders never worked alone. Delegation doesn't mean losing control. It means gaining time for what truly matters. In many pharma plants, QA becomes a bottleneck because leaders hesitate to delegate. Strong quality systems depend on trained teams, not overworked individuals. No matter what you do, people will have opinions. If you succeed, they talk. If you fail, they talk. So whose life are you living? Approval is addictive. Freedom is expensive. Choose wisely. In healthcare and pharma, fear of opinions often stops people from raising quality concerns. Silence may feel safe today, but it creates serious compliance issues tomorrow. Many people live lives designed by others. Parents, society, circumstances. But a life not chosen consciously becomes a life of quiet regret. Your life deserves your signature. Long shifts, night work, and constant pressure are common in pharma and healthcare. But sacrificing your entire personal life eventually affects judgment, focus, and patient safety. Failure is not fatal. Fear of failure is. Most people don't fail, they quit too early. Failure is feedback. Regret is permanent. Choose learning over fear. Many quality improvements fail to start because of fear of audits, blame, or management reaction. In reality, regulated industries improve only when controlled risks are taken. Complaining gives temporary relief, but permanent damage. It drains energy without solving anything. Fix it, accept it, or leave it. Complaining keeps you stuck. Complaining about workload, audits, or systems is common in pharma. But complaints without action never translate into CAPA or real improvement. Unfinished tasks occupy mental space. They follow you silently. They steal focus. Completion brings peace. Finish what you start. Pending deviations, change controls, and investigations are not harmless. In pharma, unfinished tasks quietly accumulate into audit findings and compliance risks. Trying to please everyone means disappointing yourself. Strong people say no. Clear people choose boundaries. Not everyone needs to like you. You need to respect yourself. In pharma, trying to please production, management, and auditors at the same time often leads to compromised quality decisions. True compliance requires courage, not approval. Comparison steals joy. Different start lines, different paths, different pace. Your only competition is who you were yesterday. Comparing your plant, your career, or your audit outcomes with others creates unnecessary pressure. Every facility, system, and professional grows at a different pace. Money can return. Opportunities may return. Time never does. Now that you've seen these time wasters, you have a choice. Continue as before, or change consciously. In pharma and healthcare, time is not just money, it is patient safety. How you use your time directly reflects the strength of your quality culture. If this video made you pause and think, it has done its job. Don't forget to like, share and subscribe to PharmaHealth Insights.